The annual Breastfeeding Week, breastfeeding has become a blessing in disguise to some extent for mothers working from home. And with the emergence of the highly dreaded COVID-19 pandemic globally, breastfeeding is still and remains the best meal nourishment for suckling babies. Nanok Lorraine reports.
Smiles and joy comes to many mothers who bring forth their bundle of joy, and right after breast milk becomes their first source of nourishment. The World Health Organization recommends mothers worldwide to exclusively breastfeed infants for the child's first 6 months to achieve optimal growth, development and health. Unfortunately, not all mothers get the opportunity to breastfeed their babies due to different conditions. In such cases, alternative ways such as wet nursing can be embraced. A noble example is of one Doreen Mulinya, who after giving birth 6 hours after her sister-in-law, took the brave step to wet nurse her niece after the mother developed stomach cancer complications, which then deprived her of enough milk to feed her baby.
I had a lot of milk at that time. I was breastfeeding her. But on the other hand, she did not have enough milk. It reached a time that she did not have any milk. Totally. I decided to try and breastfeed the child. I breastfed her for like 1.5 months, but that was long enough to help her gain back the weight.
She says those volunteering to wet nurse need to undergo several tests to ascertain the safety of their breast milk, and if another chance avails itself, she will gladly grab it to save a smile.
I would. Because when I'm breastfeeding, I usually have excess milk. I don't know, I'm that healthy. So I would not mind. Being that I'm also a mother, I know the benefit of breast milk to a child.
With the emergence of the novel coronavirus, many lactating mothers have become skeptical of how safe their breast milk is to their newborns. And to mothers who are tasked with handling COVID-19 patients have been called upon to practice the highest form of personal hygiene before beginning to breastfeed.
It is considered to be safe to breastfeed your baby through the period, through the pandemic. If a mother is found to be COVID-19 positive, she should wear a mask when breastfeeding her baby, maintain hygiene, wash hands, sanitize, wash hands, and still breastfeed as normal.
With this year's theme being Support Breastfeeding for a Healthier Planet, lactating mothers have been urged to carry on with the task because in it comes a ton of benefits to both them and their young ones.
Babies who are breastfed are healthier in terms of they suffer less diseases and infections, so they have less hospitalization and places a much less strain on the medical system. It reduces the chances of a mother getting cervical cancer and breast cancer in future, and so that means that mother is healthier.
Nanok Lorraine, TV 47.